Hello and welcome to the Unit 5A presentation on safety. These are your learning objectives for this section. Please review them and be familiar with them. These next two slides review what we'll be covering in this presentation. You can pause if you need to and take a minute to look at them. National patient safety goals are established by the Joint Commission for all hospitals and long-term care facilities nationwide. They're designed to prevent errors and improve patient care and safety provided by the hospital and its employees. These are some of the 2015 goals of importance. Some things hospitals do to address these goals are to use 2 patient identifiers, use SBAR format communication with report, implement EMRs, work to reduce unnecessary alarms which lead to alarm fatigue, incorporate isolation precautions and hand hygiene, and participate in root cause analysis to identify safety risks in the system. Correct patient identification is crucial for any patient interaction, even if you've asked for this information multiple times in your shift. Ask the patient's name and birthday and compare the order, or check the armband for the name and medical record number and compare this to the order. You must verify what the patient tells you against what is in the chart and armband for accuracy each time. Do not rely on your memory alone. So what if your patient isn't wearing a band, such as in a skilled nursing facility? In this case, you need to ask the patient's name and date of birth, and many dementia and Alzheimer's units have patient photographs in the chart for identification. It is never appropriate to assume it's the right patient because they're in a certain room. Remember, sometimes confused patients wander. The patient goal of the client will remain free from falls can be used for almost all patients anywhere, anytime. Always assess your patient for their fall risk and implement fall precautions if necessary. Falls are preventable according to the Joint Commission, and facilities may not be reimbursed for injuries resulting from falls. These are several factors that put patients at risk for falls. Nursing interventions should focus on modifying surroundings and implementing measures to prevent patients from falling based on the factors putting them at risk for falls. The Morse Fall Scale is a common tool used in healthcare facilities to evaluate risk for falls. There's an example here on this slide. Please be familiar with this tool and how to fill it out to determine the fall risk. The Get Up and Go test is a quick observational assessment that determines a patient risk for falls. The Get Up and Go test requires patients to stand up from a chair, walk a short distance, turn around, return, and sit down again. It tests balance specifically in elder patients. So stop here and think for a minute about some possible priority nursing interventions you could implement to prevent falls. This slide and the next slide outline some very important nursing interventions to prevent falls. These are considered fall precautions. Failure to do some of these, especially locking wheels and keeping the bed in low position, are considered negligence in the event of a patient injury. Restraints are sometimes needed, especially if the patient's pulling at lines and tubes that are necessary to sustain life, such as IVs or breathing tubes. Also, restraints may be needed to prevent the patient from harming themselves or someone else. They are never used for staff convenience, however. There are several types of restraints. Physical restraints include soft restraints, Siderails sometimes. This depends on the agency policy because they can be also used as a positioning device. Also included are leathers, posy vest, mitt restraints, and lap belts as types of physical restraints. Chemical restraints include antipsychotics, Haldol, Ativan, ketamine. They're not considered a restraint if it's to treat a medical condition. So an example of this would be giving Ativan for someone having a seizure. This is not considered a restraint. However, giving Ativan to someone having a severe agitation episode could be considered a restraint. Seclusion is a room free from stimulation with no removable objects, continuous visual monitoring by trained staff, and the patient may or may not be in 4-point restraints. This means their arms and legs are all restrained. Notice the camera in the room above the bed in this picture. Anytime someone's in seclusion, they must be continually monitored. Restraints are used to prevent injury to the patient or other people, but they can create a safety hazard, especially if they're applied incorrectly. For example, restraints can be a strangulation hazard. Think about a roll belt or a lap belt or a vest, or an entrapment hazard, such as Siderails. They should only be used after every possible alternative has been tried and documented because of the risk of serious complications. Renewal and initial ordering vary depending on whether it's a behavioral restraint for a combative patient or a general restraint to prevent falls or prevent removal of life-sustaining lines. Generally speaking, though, the provider must order the restraint within 12 hours of application for a medical restraint, and they must renew the order every 24 hours. Some potential nursing interventions that could be tried before initiating a restraint are listed on this slide. Always consider medications the patients may be taking. Are the medications making it worse? Or could medications make it better? For example, is the patient having uncontrolled anxiety or pain that would be benefited by medications? This slide walks you through using restraints following the nursing process. Please take a few minutes to review. So are Siderails a restraint? Not always. Check the agency policy. They can be considered a restraint if they're used to prevent the patient from getting out of bed, but they're not typically a restraint if it is to improve patient mobility or if the patient requests. For example, does a patient want 2 Siderails versus 4 Siderails? They can be very helpful to the patient. If used properly, Siderails can increase the patient's mobility and stability. If used improperly, though, Siderails can cause more injury. So OSHA regulates workplace safety. Failure to comply with OSHA guidelines can result in financial penalties for organizations. Sharps put healthcare workers at tremendous risk for bloodborne pathogen exposure, which can lead to hepatitis B and C and HIV infection of exposed workers. Please review the Bloodborne Pathogen and Universal Precautions handout on E360 and treat every patient as if they were infected because you can't tell just by looking at someone. To prevent needle sticks, never recap with 2 hands after an injection and always know where your sharps container is before the injection. Sorry, a little technical difficulty there. This is a short 2-minute video clip that shows the one-handed scoop technique if it's necessary to recap the needle. I can't get it to play on this presentation, but if you go back into E360 and look at your printable PowerPoint, you'll be able to click on it and watch it, or you can just type in the link above and then you'll get the video to come up. Back injury is another risk for nurses. Please protect your back. Once it's hurt, it can cause lifelong pain and problems. Use lift equipment when available, get extra help lifting, and if the patient's able to, have them do most of the work. For example, the patient can bend their knees and push themselves up with their legs while you're boosting them up in bed. This takes the load off of you. So you can look in your text for some examples of proper body mechanics. It's always good to know and understand this because lifting properly with things close to your core and knees bent is going to help you more than lifting from your back, and it's going to result in less chance of injury. So thanks, and that's it for this presentation on safety.